It's the Brian Lehrer Show on WNYC. Good morning again, everyone. Now we turn to something our next guest calls the time tax. And even if you've never heard it described that way before, odds are you've paid it. It's the hours you spend doing your actual taxes, applying for benefits, fighting a medical bill on the phone, filing for unemployment, getting a business license, waiting in line at the DMV. The list goes on. Annie Lowrey is a staff writer at The Atlantic, and she coined the idea of the time tax in a 2021 article. Now she's got a book called The Time Tax, How the Government Wastes Our Time and How to Fix It, where she looks at something many of us have come to accept just like as a fact of life, that trudging through bureaucracy is the price we have to pay to get the services and benefits we're entitled to. Spoiler alert, I'm going to ask her, isn't this just as bad in the private sector? But Annie, welcome back to WNYC. Always good to have you on.
Thank you so much for having me.
Why did you focus on this for a book?
I felt like, it was almost 20 years ago when I started to notice this when I was out reporting. And really, when I was talking with people, the thing that I was concerned about had to do with federal safety net benefits. I was talking to a group of veterans who were homeless, and they just couldn't access the help that the VA wanted them to access. But then I started seeing it everywhere. And I think you're completely right. Private businesses do this to their customers. The number of kind of cookie notifications and terms and conditions we're expected to comply with, to get loans, to go out to college. It's really, really everywhere. But that doesn't mean that it doesn't hit certain people harder than others.
Right. And that's part of the point. Some can shrug it off as an inconvenience. For others, I guess, people who disproportionately need government help, and those would disproportionately be poorer people, it's more than that, right?
Absolutely. So I would say that, yes, higher income people might face the same issues, but they have more resources. They have more time. They can hire an accountant to do their taxes. They can decide to just pay that medical bill, even if that doctor that they want to go to is out of network. Whereas lower income people, they don't have the capacity to do that. Other groups of people that I think are disproportionately affected by this are people who are not native born to this country, not U.S. citizens, people with a history of involvement with the criminal justice system, women who tend to be lower income, tend to be the people who are getting benefits on behalf of their kids, tend to do a lot of the household management. So like signing your kids up for after school or summer programs, that kind of thing. And then, yes, low income Americans, absolutely, which is something that we've known. You can go back to Cloward and Piven were writing about this in the 1960s, and I'm sure there's great examples from even earlier than that.
And listeners, who has a time tax story? 212-433 WNYC. What kinds of paperwork, especially from the government, we're going to get to the private sector, eat up your time? And how has it changed your opinion of the government? We're going to talk about faith in government and who's maybe for this kind of thing for political reasons, or your opinion of social services programs that you benefit from. What do you wish the government would do to streamline all of this and, lower the time tax? Calls and texts welcome, 212-433 WNYC. Help us report the story with an experience, or just ask a question of Annie Lowrey, whose new book is The Time Tax, How the Government Wastes Our Time and How to Fix It, 212-433-9692. One of the most interesting things to me from the book is your notion that a lot of people assume these systems are just badly designed or poorly administered. But you argue that, at least in some cases, making benefits difficult to access is actually part of the point. It's like, with Trump, you hear the critics sometimes say the cruelty is the point. In this case, the bureaucracy is the point.
Absolutely. I think we can see this really clearly with businesses, actually. So in a lot of cases, it's really easy to sign up for something online. But then there's this subscription that you don't quite notice. And finally, months later, when you realize that you've been paying $15.99 for something, you go to cancel. They say that you have to write a letter or you have to call. You can't just do it online. And I think that that's a pretty clear example of, businesses want to make it really easy for you to spend money, and they want to make it as hard as they can for you to stop spending money. Or, I think a lot about the airlines, right? There used to be a rule that if you were involuntarily bumped from a flight, they would have to compensate you. And now that rule doesn't exist anymore. And you end up with all of these, here's a $25 food voucher and maybe we'll give you some miles. But like whoever actually uses that stuff, it's annoying to do so. And so, yes, in terms of the government, I think this is a fundamentally illegitimate way to make programs smaller. So if we say that, we have a program that we want to be helping an at-risk kid just happened to be born to a low-income family, I think it's fundamentally illegitimate to make that program harder for that family to get on merely because of the paperwork. And, that's understanding that, yes, there's going to be checks, there's going to be fraud checks. We want to make sure that they are actually eligible. But a lot of this stuff is really, really unnecessary. And it's purposeful. It is impressing upon people that they are poor. It is shrinking the size of programs by making them onerous to use, which, is in my mind, this is a huge public policy problem, and it's affecting all of us.
Listener writes, I'm 85 years old, and I feel as if I will spend whatever years I have left doing paperwork. It totally consumes my life. Can't stand it. Tracy and Teaneck, you're on WNYC. Hi, Tracy.
Hi, thank you. I am blind, and I need to verify my identity to get through the New Jersey property tax relief and to get access to Medicare online. And the app they both want to use is called ID.me, and I have spent like about 10 hours this week trying to do this, and I still don't have my identity verified. I'm not any closer than I was when I started, because it's demanding that I take pictures either with my phone or with my computer camera, so I have to have somebody help me with that. I finally got a picture of my ID, and then it said it had expired. It hasn't expired. It's a nightmare.
Have you asked anybody about this, like in your particular case, somebody who's blind, if there are not accommodations?
Yes, I have, and people say, no, we're having trouble with this too. But apparently, different agencies implement it differently. So the IRS has one way of doing it. Medicare apparently has another way. New Jersey has another way, and I'm in contact with my assembly person who says that she can find me a workaround. But really, why does it have to be so hard?
Thank you for putting a human face on this from Annie's book. Tracy, good luck with all that. Do you have any advice for somebody like Tracy?
This is really, really tough. And I think that you've identified a lot of the issues. Very often, the government will have workarounds for people who, like you, have blindness or vision loss or might have any of another issue. But that means that you're working in some other system, and who knows how well it works. As you point out, all of these programs have different rules. You might have to do the same thing of ID verification multiple times. And, the easier it is for you to do something, perhaps because you're, happen to have the good grace to be in a healthy body, or you have money, or you have, a fancy iPhone and an up-to-date computer, which a lot of people don't, the more issues that you're working with, the harder it's going to be to comply. And what I would say, just in terms of advice, because I think that this is really, really hard, is that very often these offices will have folks who are supposed to help people with disabilities, with differences. And very often they'll also have like an advocate service. So the IRS has the taxpayer advocate service. And very often those people can help. But I would love to tell you that there was some magic wand you could find that you could wave and it would just make it easy. I've never found one. And just hearing this story, it breaks my heart and it makes me so angry. So angry. And I sincerely hope that you get it sorted. But I'm sorry that you have to go through this.
Here's another one. G in Westchester County. You're on WNYC. Hi there.
Thank you so much, Brian and guest. Gosh, I spent the past 6 years being the power of attorney, doing everything from my mom. And just recently, she is applying for Medicaid. I'm applying to Medicaid for her with someone I hired to apply for Medicaid. And it's still a year and a half later. We've gone through 3 different employees at this company that we paid a lot of money to. Would you like me to say the number?
Sure.
And we paid $13,500 for this company to do the Medicaid application for her. I mean, she's been down to no money for a year and a half. And we've gone through 3 people who I'm not always sure of their level of competency with this company. But then recently I was just on the phone. I mean, this is multiple people are going through this all the time. I was just on the phone because Medicaid in Connecticut is asking for a Schedule A that is not a tax document. It's something from a prior estate planning form, perhaps, that her lawyer in the Midwest said hasn't existed for 35 years. He refuses to help me with this. I'm trying to conjure up her banking numbers from 2011 when the trust was created, because she didn't actually just put her car, her house, which have all been sold, 6 years ago. Whenever, like 4 or 5 years ago, to keep paying down her, she went into assisted living, skilled nursing, memory care, back to skilled nursing, which is where she is now. And so I was on the bank, and I was with the bank for like an hour and a half, and they couldn't answer my question. They have to probably do research because it's so far back. So I still don't have the information to give them to them, and apparently her application is, or whether there will be a big penalty is pending. What were the items that were placed in the trust at this time? I mean, this is 2011 we're talking about.
For a Medicaid application, right?
So, yes, so it can reimburse her where she is currently staying in Connecticut, where she's been for a year with Medicaid pending. Thank God she was able to get in because she was at a sister facility where we were paying buku bucks,
And one of the things from this story, that's, I'm sure, making everybody's heads explode like it's making my head explode, is the paradox of if somebody's poor enough to be on Medicaid, you're paying this advocate, you have to pay them $13,000 to be the advocate. But if you're poor enough to be on Medicaid, who's got the $13,000 or without at least like further bankrupting yourself? Annie, is your head exploding?
My head has exploded. I am so sorry. And again, it's like, for what? What is the risk that your mother is defrauding the government or not obeying by the rules? If she's in a skilled nursing facility, this is absolute madness. The notion you would go to a private firm and, like for the prior caller, I am so sorry. I hope this gets sorted. I would certainly publicize this and tell your state's Medicaid administrator that this is happening. Huh. And, the thing that makes my heart break even more, Brian, I know, as you've talked about on your show, H.R. 1 is rolling out, which is going to cut $1 trillion from the Medicaid program by putting more paperwork on people. Right? This is about to get a lot worse. And so I sincerely thank the caller for sharing her family's story. And I really hope it gets sorted in a way that will ensure that her mom can get the care that she needs.
So, in Westchester, there's maybe one good bit of concrete advice from Annie Lowrey, and that's to contact the New York State Medicaid director and complain right up to the top of that particular chain. That is what you said, Annie, right?
Yeah, absolutely. Find whoever is running Medicaid. And I couldn't quite tell whether she was in Connecticut or New York, but whoever is running, the Medicaid program there, I would certainly write this all out. And they have to know when these systems are creating these problems. Yeah.
You mentioned the one big beautiful bill. Yeah, the work requirements. You're right. We've covered this on the show a number of times. The work requirements for Medicaid eligibility. So much of the country supports that politically because it sounds like a fair social contract. If you're getting your basic stuff paid for by the government, you should at least be working in some way, right? If you can't work in the private sector enough because there isn't a market for you, whatever, that you get these things done privately. If the government is subsidizing you, then you should at least be looking for work or going to school or doing volunteer work, which also counts. Fair social contract to a lot of people's thinking. But what it actually does for many people is just place a time tax when they are qualified through the actual behaviors that they're exhibiting, the work that they're doing, but the time tax dissuades them from going through with the application. That's that, right?
Absolutely. And notably in the case of Medicaid, two things, Brian. One is that some states have actually had work requirements in their Medicaid program before, and it didn't lower the unemployment rate or change the employment rate among people subject to the requirement. So it does not effectively get people to work. Why would that be? Because a lot of people who are on Medicaid are already working if they can, but they can't always prove that to the state in the way that the state requires, which is really burdensome and onerous. It can often be on these really rickety systems. So you might be working or volunteering for 80 hours a month or in school, but you also have to prove that. It's not just the work requirement, it's that you have to prove it. The other thing is that this work requirement is being applied to people who, are older Americans, 61 years old. To people who might not be able to prove that they have a disability because they can't access healthcare in the first place. To people who are homeless. How are you going to comply with a work requirement if you are homeless? I mean, I don't have an answer to that question. They're not going to be able to. So then they won't have Medicaid coverage. And then what happens if they end up in the ER or they need a psychiatric medication or some other kind of medication? Right. This is going to kill people. It's going to, people will die. I mean, that is going to happen.
G's head exploding story brings me to why I was going to raise the private sector with you in this, because it definitely doesn't rise to the level of what G just told us. But I've spent hours in the last week trying to help my mother with a health insurance denial on a particular thing. Right? Much smaller in the scheme of things than anything G or the other caller is going through. But just dealing with this health insurance company, it's taken hours of bureaucracy. And today I'm going to have to go out to the post office after the show to send them something that they will only take in regular mail or a fax, not by email. And that's a private insurance company, which, not surprisingly, puts up a lot of barriers to getting your benefits. So I guess there are you talked before about, private sector companies, they want you to buy things. So they make it easy for you to navigate their websites or whatever. But I guess maybe it's particular ones like health insurance companies.
Absolutely. The health insurance system that we have, which, the point is to make sure that people can get medical care, is enormously onerous, absolutely enormously onerous. It forces people to act as their own bureaucrats in order to get the health care that they are paying for. And it throttles access to care through annoyance. It uses this bureaucratic friction. There's a really great study that I like that shows that working Americans spend close to 500 billion hours on the phone with insurers per year. I mean, it's just like an absurd, 500 million, I think. It's just like an absurd amount of time. And I think that there could be fixes to the system that would protect consumers and help to wring some of the paperwork out of it. And I would note, it's not all that easier, I think, for medical providers who spend huge amounts of their time just doing paperwork, like prior authorizations. You can talk to a doctor or a nurse or a physical therapist. They hate it too.
Just briefly. Your book is called The Time Tax, How the Government Wastes Our Time and How to Fix It. So before I let you go, on the fix it part, just what are some of the most obvious solutions that you came across? And then people will have to read the book to get the rest or go to this event you're going to have in the city, which I'll tell them about.
Absolutely. I think one of the most straightforward ways to fix this is right now there's some legal prohibitions on a lot of our great offices with great civil servants working in them, preventing them from delivering for the taxpayer, delivering for the citizens that they represent. So one version of this is that the IRS already has the information it needs to do your taxes for you, probably. 9 out of 10 families use the standard deduction. the IRS is already getting payroll information from your employers and financial information from banks and retirement funds. They could just do your tax forms for you, send them to you. You could look them over. If it looks okay, great. If you want to change them or do it by hand, great. The IRS is legally prohibited from doing that. And you can see that in agency after agency after agency, where we have really smart civil servants that would love to, say, fix their state Medicaid program or make their jobless insurance work better or pass a regulation that would prevent private companies from harassing the consumer. And they're not allowed to. And that feels like a really great, low friction place to start. Wouldn't cost a lot of money. And that's one thing that I think that we could do.
Good stuff from Annie Lowrey, who's been on with us multiple times before for other good stuff that she's put out there as a staff writer at The Atlantic. Now she's got the book, The Time Tax, How the Government Wastes Our Time and How to Fix It. And if you want to see her in person, she'll be having a related event at the 92nd Street Y. That's coming up on Tuesday, September 22nd with PJ Vote, 92nd Street Y. Tickets at 92y.org. Annie, thanks a lot.
Thanks for having me.